Kelly, Republican from Pennsylvania. You've hosted live telephone town hall meetings on the coronavirus. What was your goal in setting up these meetings?
I think that anytime the government comes out with any type of a policy or a program, it's always fascinating. It seems easy to those who are setting it up, but for those who are trying to understand it, it's very difficult. So what we tried to do is do it on a basis where people could call in, they could ask their questions. We would try to help them navigate the system. And Larry, we're doing in excess of 4,000 calls a week to our constituents who have questions. So we thought, well, okay, let's do a telephone town hall where we'll get, I think we got close to 10,000 people on it, where they would share in, and a lot of people were asking the same question. So people listening in would say, that was the question I was going to ask. Thank you. I don't need to be on the call. And a lot of the early part was Small Business Administration efforts, trying to get the Paycheck Protection Program in, trying to get EIDL in, trying to find out what we could do to help relieve some of that anxiety about what's going to happen to my business when a new government policy completely upended the stream of revenue and my business plan. So you participated as well as representatives of the federal government. You guys were all on the line at the same time? Yeah, we had federal government on, we had state people were on, Pennsylvania state people were on. So we covered the whole gambit of what it was that was concerning people. Having the state people on was a huge help because a lot of what we talked about were unemployment benefits and then the bonus checks and how that was supposed to work. And that's Pennsylvania that has to answer that. The Small Business Administration stuff was pretty much the feds. And the Paycheck Protection Program, how would I get to that was pretty much federal. But we had that whole gambit. So
let's talk about the Paycheck Protection Program, sure. Congressman. Just what are the details? What's involved?
Well, you know what? I think for everybody, whenever we first put the program out there, it sounded like it'd be really good. But what the effort was, and I think the thing that maybe early on was confusing, is for people to go to a lender that they were comfortable with. And the most important thing is, if you already had a relationship established with a lender, then go to that lender. That lender then will link in with the federal government, and that'll close that gap. And that was, I think that was the biggest thing of getting people to understand that, and then to getting the lenders on board where they were comfortable with doing what they had to do from their end in order for that process to take place. So a lot of it was, again, just slowing down the process, taking slow walking through it, and then bringing some kind of peace of mind to the people who need the paycheck protection, and letting them know early on. One of the things early on, this is a good point. The back and forth was there was very little flexibility, and people were saying, "Well, I mean, it's kind of a compressed time for it to end up being a grant instead of a loan. 75% of it has to go, and I have to do this and this and this, and then." So we were able to, we being members of Congress, listening to what people were saying, were able to get some more flexibility in it to lengthen the time of period, to get the money used, to get it used in the right way where you're actually using it for payroll expenses. And I think that was a key to it, to bring kind of a peace of mind to the folks that were actually participating in the program. But that relationship between their lender was really key.
Now, I understand the Internal Revenue Service was participating too. And what kind of questions were they answering? Of course, tax day was moved due to coronavirus.
Yeah, well, I think that, moving back tax day was a big thing. But the other thing that was there was, the question was, is this a taxable event? If I get this money, and then all of a sudden, now it's been given to me, is that a taxable event, or am I tax-free on these dollars? And the answer was, no, there is no taxable event. And I think that's where having the Internal Revenue Service on board with it, that kind of calmed people down. Anytime you have people who do this stuff every day, who work through these problems every day, they have a way of talking that's much, much easier for taxpayers to understand. So we were able to do that, and I think brought a lot of peace of mind to our constituents as to how this works, and the fact, listen, this is not a tax burden for you. This is a bridge to get you across a very difficult time. And we increased the length of time, had more flexibility in how the money could be spent, and I think that was the key.
So let's talk about the consequences of coronavirus on small business. And of course, they're looking for any kind of relief they can get for circumstances that they've never seen before. And some of these businesses won't be able to reopen.
I think that's the sad part. There are going to be people that don't recover. And I think we all know. Myself, I'm still in a small business. I consider it a small business. Maybe other people would think it was bigger. But the balance is so delicate. And I think as individuals, we take it for granted that that little restaurant on Main Street or a side street doesn't have to worry, that that small manufacturer, he or she doesn't have to worry, that that service industry, that's no big deal to them. And then all of a sudden you find out, well, when the revenue streams dry up, not because of a flaw in their thinking, of the business owner's thinking, not because of a blunder that somebody made, something's totally out of your control. The fact that this pandemic takes over and the government makes a decision that you're going to be shut down. Now in Pennsylvania, it was the life essential businesses, and I think the biggest problem that a lot of us had with that was the governor established who could stay open, who couldn't stay open, and there was really no remedial that you could go and say, well, I don't understand this. I don't think that the guidelines that are issued that were anyway not able to comply with those. And so, again, working with people on a one-to-one basis, and what you said earlier, that panel where we had people from the state on, people from the federal government on, that wasn't just somebody saying, well, this is what I think, but you're going to need to check. This was people giving absolute information to business owners about how this would work and the importance of it and how the relationship would work out. So, but getting back to your initial part, there are some people that aren't going to make it through. It's just, I'm sad to say that, but there's some friends of mine that aren't going to.
Time is limited. Just what kind of relief can a small business count on from the federal government?
Well, I think that's the question. And people would say, and here's the one, they'll say, well, you know what? My friend got this, I didn't. Why did that happen? And again, the purpose of the federal government was to supplement or replace what was taken away, not by the business's failure to plan their revenue streams, but by the pandemic and then the policies that were set forward. So I think that for the biggest part, most business owners were satisfied or felt relieved that the government stepped in and was able to do something. But, the size and scope of what it was that the federal government was trying to do is just off the charts. And I said the day that I heard we were going to do this, I said, I'm afraid we've opened a Pandora's box that we'll never get the lid on again. And as you've noticed, going through the CARES programs in phase 1, phase 2, phase 3, phase 4, whatever, we're still looking at the forgotten and what we can do to help those folks get through. So we're constantly looking at funding, being able to extend funding to help people get through a tough time, and to try to make sure that it's not one of those things that's so overwhelming that people can't recover.
So when you have your town hall meetings on telephone, what did the callers have to say about their stimulus payments? Doubtless most of them had received them by then.
Quite a few did. And we had a lot of complimentary remarks made. I think the one thing that, again, I go back to what I said earlier, some people were wondering why it was that one business got their check and the other one didn't. And then it becomes, well, why was I left out? And it's not a fact that they were left out. There may have been something that wasn't covered completely or not done the right way. And again, it goes back to what was your relationship with your lender? How comfortable was your lender with this program? How comfortable were their relationship with the federal government? And so all those things come together. I think we were able to, with our office and the people that are on staff, we're able to establish these relationships and intervene to try to bring some calmness to that whole situation. But as I've said earlier, that initiative, there's not another nation in the world that could do what the United States did. I mean, they certainly couldn't do any of these other, and there's a lot of hot spots around the world. But imagine the immensity of the program in the United States, where we weren't only taking care of individuals, we were trying to take care of businesses, small business, and some very large businesses too, by the way, who needed that assistance in order to get through that time period. Because what we were really talking about are jobs. And how many jobs were we going to lose?
During your meetings on the telephone, was there one topic that dominated the discussion and perhaps it surprised you?
I think I was more surprised than anything else with the number of people that did get their checks, the number of people that did feel very comfortable with the program, and the people that felt that without that program, they would not have survived. So I was pleasantly surprised by the effectiveness of the program, because I was really afraid, as I said earlier, that this was a Pandora's box, would never get the lid on again, and would never be able to service the number of people that we've been able to service. So that was a pleasant side of it. I think one of the other things I can tell you from the town halls were individuals talking about the checks that had come, and maybe it was a wife saying, well, you know, I got my check, but I also got a check from my husband. He passed away in October or November. And so they were saying, well, if you filed taxes, this is how it worked. And if that notice hadn't got to the IRS, they were sending these checks out. And then the question is, what should I do with that money? And the answer was, you need to return that to the government. And I got to tell you, the surprising thing, there weren't people saying, oh, are you sure? Are you sure? Because I'd really like to keep that money. Even though it was a mistake, I'd like to keep it.
Sounds like
at least where we're from, you know what we're saying? I want to get that money back, and maybe there's somebody that didn't get a check, and this will help alleviate that problem. So I was really very encouraged by the people that I served, that they were on board, said, no problem, we'll get the money back. Just wondered what I should do.
Now we have just a few minutes left, Congressman. I understand you had your own personal bout with COVID-19, and it started back in March. Tell us what happened.
You know, right in that middle of March, right around St. Patrick's week, my wife noticed it more than me. I was just getting up. We were doing a district work week that week, and I was visiting people, and then all of a sudden, people said, "Well, you know what? Let's not visit personally. Let's just talk on the phone." But I was still on the road quite a bit, and she said, "You're not feeling well. You need to go get checked." I said, "No, I'm fine. I'm fine. I think I just got a little flu bug. I'll be all right." Well, she said, "No, I think you got more than that." So she called our family doctor. I went to a mobile drive-in up at the Butler Hospital. They did the swab. They called me up the next day and said, "You know what? You've got coronavirus."
Huh.
And then it started. And then it was like, you're sleeping 16 to 18 hours a day. You've got chills that you can't control. You have a complete loss of appetite and taste. I lost about 30 pounds in 10 days. I had muscle cramping through my neck and across my shoulders, headaches, and I didn't have quite the respiratory problem that others did. I would notice that when I get up in the morning and went up, we live in a very old house, to the third floor to shower and come back down, I'd have to sit down and get my breath again. But I never was on a ventilator. I never was on oxygen. So I was really blessed that way. I did take the hydroxychloroquine. Now people ask me, do you think that's what kept you from getting the respiratory part of the virus? I said, I can't say that. All I can say is I took it and I didn't get those symptoms. So, and now, you know, but even out of some bad comes some good. I got an information from a friend of mine that I had gone to high school with, who's a doctor. He said, go and get your blood tested. You may have the antibodies that they could use to, there's a plasma program for immunologists. Right. And so we went to the University of Pittsburgh Medical Center, talked to Dr. McDyer, tested my blood, took about a half dozen vials, did the nose swab again, called me back 2 days later, said, you know what, we can use your plasma. So I started giving my plasma, and which is a very easy thing to do, very safe thing to do, totally painless. But you know what, it could have a huge difference in somebody's life. So even out of that bad part of losing the weight, not sleeping all the time, having horrible dreams, by the way, I got through all that, and then the plasma may, again, do something positive for somebody else. So I'm back on my feet, about 3 months clear of the virus, operating every day, doing things all day long, and feeling very good.
So certainly this new appreciation for the coronavirus, having this personal experience, this has got to inform your decision-making to some degree, right?
Yeah, it absolutely does. Because, early on I said, look, it's the flu. I got the flu. I did have the flu, but it was the coronavirus flu. And it was, believe me, it knocks you off your feet. And for people whose immune system's compromised, it can be fatal. So you have to take it serious. You have to do all the things that we say we have to do, and you have to make sure that you contain it just within your sphere of where you live. Self-quarantine, make sure that you're doing the self-distancing, wear your mask, make sure you wash your hands, cover your mouth when you cough. All those things we learned as children are still in play with this.
Last question, Congressman. What is the next big hurdle for the federal government in fighting coronavirus?
I have watched it. It started off with ventilators, and then it went to PPE, not having enough of the personal protection for the people who were actually frontline. Then it's come down to the testing. We're finding out a lot of people who had the symptoms never really knew they had the virus. So I think we look at right now, the other element, first of all, there's a lot of economic damage with this. There's another thing that's not being stated. It's the mental health of our fellow citizens. They have been bombarded with this information on the coronavirus. At some point, we have to come out, start living our lives again, start interacting with other human beings. I have friends that still won't go out of the house because they're thinking something could go wrong. We have people that don't want to go back to work, not because they don't have a job, but they're afraid to go back into their workplace. So getting over that hurdle, the economic hurdle, then the mental health end of it is critical. I think once we find a fact we can test whenever we need to, and we come up with some type of a vaccine, then I think people will feel more sure of it. But right now, I can understand why some people are still skittish on it. I understand it, having gone through it. But I also tell people, you use your head, do the right things. And for people in business, follow the guidelines. Look what's set up. And if you follow those guidelines, you're going to be able to open up safely. The idea is to be both smart and safe. We can do that.
Congressman Mike Kelly, Republican from Pennsylvania, thank you very much for spending time with us.
Thank you, Larry. Appreciate it. Bye-bye.
Senator Kristin Phillips-Hill, Republican from York County. Healthcare workers are required to wear an ID badge. Under current law, what information must appear on that badge?
Under current law, a healthcare worker's full name is required to be placed on their badge. And I have introduced legislation, Senate Bill 842, that would omit healthcare workers' last names from their facility identification badges.
And at this point, Senator, just in general, which healthcare workers are required to wear these badges? Do they have to be face-to-face with patients?
Every healthcare worker, when you go into a hospital or other healthcare facility, is required to wear a badge to identify themselves as an employee of that facility. And the impetus for this is really that incidents of serious workplace violence were on average 4 times more likely in a healthcare setting than in private industry. And, healthcare workers are subjected to violence in the workplace, and also violence that starts in the workplace but follows them home, stalking, harassment, assault. And the largest source of violence towards healthcare workers are often patients or other clients or customers. And, we know that in today's modern age, personal information about a healthcare worker, such as a photo, a first name, a last name on that identification badge, can really easily assist an ill-intentioned individual in committing physical assault or other threatening types of behavior.
So let's be clear about what your bill would change exactly on the healthcare worker ID badge.
Right. So simply would omit an individual's last name. It's really just one small way that we can help those who help us every day. And now in these last several months, with healthcare workers on the front line of battling the COVID-19 pandemic, extending some safety and peace of mind to those individuals is really important.
You started working on this bill months before the pandemic. So talk about your thinking back then and what convinced you it was a serious problem.
It was talking to those individuals who work in healthcare, who shared stories that really made the hair on the back of my neck stand on end. No one should feel unsafe in their workplace. These are people who we depend on in some of our most challenging moments in life. And it was really, really eye-opening. We had a roundtable on this issue, Senator Judy Ward and I out in Altoona, and the personal stories were horrifying.
Can you tell us one of those stories, without giving us the names, obviously, just how dangerous or hazardous these situations became?
Yeah, I mean, people stalking a nurse at her home that led to almost an assault. Fortunately, was able to ward it off. Online harassment, and then violence in the workplace, where patients were assaulting nurses and other healthcare professionals, and really challenging job to be in healthcare, and certainly having some peace of mind that you have that protection is really important.
And were these attacks on healthcare workers, verbal or otherwise, were they due to a bad outcome health-wise in most cases?
Not always. Not always. Certainly there are situations where people may not be receptive of a diagnosis, but sometimes they were just people who took advantage of having that personal knowledge about an individual.
Now let's talk about the role of social media and how what role that plays in this bill that you have in the legislature.
Well, I think that in this day and age, with social media and so many things on the internet, having a person's first name, a person's last name, you are able to track them down. We have often said that in this day and age, Mrs. Kravitz, I don't know if you remember the show Bewitched, Mrs. Kravitz was that nosy neighbor.
I remember. She was the neighbor.
She was the nosy neighbor who seemed to know everything that was going on. Mrs. Kravitz could have a field day today because so many things are online, and many people, whether they're in the medical profession and education, work very hard to lock down their social media presence, to keep some modicum of privacy with regard to their lives. And
unfortunately, Mrs. Kravitz was a benign presence on Bewitched.
Well, exactly. And unfortunately, there are nefarious individuals who are bent on harming others. And this knowledge and information, it's very easy to find out where someone lives, and other things that they do. And if that person is bent on harm, that knowledge can really assist them.
So, Senator, let's look at the flip side of omitting a worker's last name from their identification badge. How does a patient pursue a legitimate complaint if they don't have the health care worker's last name?
Well, there will still be numbers and a first name on that badge. And so, of course, patients must always have the right to have recourse if they feel that they have not been treated appropriately in a healthcare setting. Nothing in this legislation intends to take that away from anyone. That's also very important.
And after all, there's an increased awareness of transparency and accountability anyway.
Absolutely. And that should really go both ways.
So let's talk about the progress of your legislation. Just what are lawmakers doing with it as we speak?
So Senate Bill 842 is one vote away from the governor's desk. It is awaiting final passage in the House, and hope that soon we'll be able to see that make it onto the governor's desk.
And given the COVID-19 situation, you suppose it could be within days? Certainly you're hopeful.
Well, typically what happens is that when we get down to the budget, a lot of things enter into the budget negotiation. And we have already passed a stopgap budget back in May. And so my understanding is the House will be in session next week, and I'm hopeful that it will be on their calendar.
We have a minute or two to talk about that stopgap budget you mentioned a minute ago, and there are funds in that for recovery from COVID-19. I understand there's some federal funds, state funds,
Yeah, so, we are the word I think everyone doesn't want to hear anymore is unprecedented, but we truly are in unprecedented times. And financially, we're looking at about a $4 to $6 billion budget shortfall. Many people have been out of work, many businesses have been closed. And so, funding a 5-month budget was the most reasonable and responsible thing that we could do. We drove out the federal CARES dollars that will provide much needed funds for nursing homes and businesses and other entities to begin the recovery process. And we made sure that we responsibly funded education, our actuarially required contributions to our pension system, our debt, and a few other things for an entire year. So we're going to come back to Harrisburg, always mindful that you can't spend what you don't have. I think these 5 months will give us a better idea of where our revenues will come in, and we'll have some challenging conversations about what Pennsylvanians actually need and what we can afford.
Senator Kristin Phillips-Hill, Republican from York County, thanks very much for your time.
Thank you.
Senator Dan Laughlin, Republican from Erie County, tell us about Erie's status as far as the governor's plan for reopening Pennsylvania is concerned.
Sure, Larry. First off, thanks for having me on today so I have an opportunity to express my concerns here. Erie County was one of the first counties to go yellow. We have our own health department that has done a pretty admirable job in keeping our cases low and our death count very low. I think early on, we all thought that, at least when I say we, the folks up in Erie here, thought we would have been one of the first counties to go green. And here we are, we're one of the sole remaining yellow counties, and we're certainly alone up here in the northwest corner of the state as yellow. So it's been pretty frustrating for our local businesses that want to go green. And it's just one of those things that when I say we, my office and a lot of people that I talk to feel that it's actually probably worse, even on an epidemiological standpoint, for us to stay yellow up here, because people are traveling further to go to get services that they could get locally if we were open.
Senator, before you go on, what was the reason the governor gave you for keeping Erie County in the yellow phase?
Well, the one metric that I talked to Dr. Levine about a week and a half ago was that the increase in our total positive case number was increasing instead of flattening off, which on paper is true, Larry, but our case count was so low that even with our increased numbers, we are still well below many of the green counties.
So now I understand you're filing for something called a right to know request. First of all, in a general sense, just what is that?
It's just, for the folks that are listening that don't understand, it's just an official request for information from state and government offices, where mine specifically deals with the red, green, yellow phase issue that we're having up here in Erie County. And what we're trying to do is we're just trying to get to the bottom of who is really keeping Erie County green, or yellow rather.
And what is it exactly you're requesting? Just what kind of specific data do you want?
Well, we're one of the counties that has their own health department, so it's a little bit different than maybe some of the other counties that people are living in. And what it is we have a health department. They're in contact with the state health department, and there's also the county executive gets to weigh in on some of these decisions as well. And what I'm trying to get to the bottom of is how it is that we are still yellow when our numbers are significantly better than Dauphin County, for example. And I'm using Dauphin County as an example because they're roughly the same size population-wise. but their numbers are significantly worse than ours.
Mm-hmm. So you're looking for communications, though, aren't you? Emails, texts.
Correct.
And you
That
feel
is
it's necessary to file this request? It's the only way to gain access to this information?
Well, it's in my opinion, it's the way to actually clear up some of the questions surrounding this. I have a lot of people that call my office that want to know, who's responsible, and I don't have a firm answer for them. My conversation with Dr. Levine a week and a half ago, she had mentioned to me that ultimately it's the governor's decision, but I've also heard from many, many county commissioners and people in the know that they typically will call the county and say, hey, your numbers are good enough that you could go green. What do you want to do? And we're just trying to get to the bottom of that.
How soon, Senator, will your request for a right to know be approved or denied?
Well, I would expect to hear this week at least, some feedback. I don't expect to get the results within, I'm sure it'll take maybe a month to get the actual results back, or perhaps longer if they decide to fight the request. But it's a narrow enough scope on the right to know request that I think it's quite well within my rights to ask this. I think it's very very straightforward. We're not on a witch hunt. We just want to know why we're yellow and who's making that decision.
What's your feeling about the controversy over the disaster declaration? There's lots of lawmakers that are challenging Governor Wolf. In fact, that's going to be in court.
It is, Larry. Let me back up, and I will say I'm going to give the governor a couple of compliments here. Okay, early on, I think that he and his team handled this fairly well. Most of the legislature was on board with the disaster declaration. I think we all wanted to keep the case count as low as humanly possible, and we still do. Don't misunderstand what I'm saying there. But as this marched on, I'd say about 6 weeks ago, we had accomplished the initial goals that were set out by the health department and the governor, the flattening of the curve, not overwhelming our healthcare system. And we really reached what I thought was a point where we could methodically open the state back up, kind of, keep an eye on things, how the case numbers are going. And at that point, it seemed like the governor just didn't want to work with the legislature anymore. And I think that led to the opposition that he is facing now.
Let's talk a little more about the phrase disaster declaration. Just what does that mean when a disaster has been declared? That must indicate some kind of actions are going to be taken, specific things that will be done.
Well, sure, Larry. And there's, there are things that are included within that declaration, that the state of Pennsylvania needs. There's different, there's some conflicting discussions going on about what will happen if he ends the declaration. But I think if people look at the bigger picture with this, is these attempts were just to bring the governor to the table to work with us instead of against each other.
Talk some more about the citizens of Erie County. And given this status you have, which is still being in the yellow, you're surrounded by counties that are in the green. And earlier you mentioned that some of your citizens are going across the borders into other counties for services.
Well, as many of us elected officials, we have to be on social media a fair amount, Larry. So you see that you get the feedback, and we are so close to the New York and Ohio border. If you're in the middle, if you're in the city of Erie, it's 20 miles in either direction, and then it's about 20 miles to the other counties. So we are dead center between 3 separate areas where we can go out to dinner, get a haircut, and do just normal everyday life things. And for us, and I discussed this with Dr. Levine, for us to be the only yellow spot up here, in my opinion, and I think she actually agrees with me somewhat, for us to be stuck in yellow, I think it's actually more harmful to our virus counts, because people are traveling greater distance to go do these things rather than staying local where we can kind of keep this contained. And that's in addition to the damage that's being done to our business community.
Is there any indication that Erie County might be included in the next wave of counties to go green?
Well, if you look at the metrics that they used as an excuse last week not to, that hasn't changed. I mean, we are staying, we're staying roughly at about that 10 new cases per day level, which, in my opinion, that's well within a reasonable amount that we should be green. We can keep an eye on this, and we have our own health department, we have a state health department backing us up, and if we do get a spike in cases, well, then we could readjust something that we're doing. But right now, in my opinion, there is absolutely no reason why we aren't green.
Last question, Senator. Are your constituents contacting you? Are they expressing a good amount of frustration over the situation in Erie County?
Yes, they are, Larry. And like most offices, we tend to keep track of people that call and emails we get. And we keep a little bit of a running total on who's for and against different things. And I would say probably about 2 weeks ago, it started running about at least rough. We're talking in rough numbers here. I'd say about 8 or 9 calls that wanted to go green for every one that thought we should stay in the yellow phase.
All right, Senator Dan Laughlin, Republican from Erie County. Thank you very much for your time today.
Thank you, Larry. Thanks for having me on your show.